Here are some guided questions. What is intellectual disability? What are the signs of intellectual disability in children? What causes intellectual disability? Can intellectual disability be prevented? How is intellectual disability diagnosed? What services are available for people with intellectual disability? What is intellectual disability? An intellectual disability, formerly referred to as mental retardation, is not an inherent trait of any individual, but instead is characterized by a combination of deficit in both cognitive functioning and adaptive behavior. The severity of the intellectual disability is determined by the discrepancy between the individual's capabilities in learning and the expectations of the social environment. What are the signs of intellectual disability in children? There are many different signs of intellectual disability in children. Signs may appear during infancy, or they may not be noticeable until a child reaches school age. It often depends on the severity of the disability. Some of the most common signs of intellectual disability are: first, rolling over and setting up, crawling or walking late, and lastly is talking late or having trouble with talking. What causes intellectual disability? Anytime something interferes with normal brain development, intellectual disability can result. However, a specific cause for intellectual disability can only be pinpointed about a third of the time. The most common causes of intellectual disability are: genetic conditions. These include things like Down syndrome, Fragile X syndrome, problems during pregnancy, things that can interfere with fetal brain. Development include alcohol or drug use, malnutrition, and certain infections. Can intellectual disability be prevented? Certain causes of intellectual disability are preventable. The most common of these is fetal alcohol syndrome. Pregnant women should not drink alcohol. Getting proper prenatal care, taking a prenatal vitamin, and getting vaccinated against certain infectious diseases can also lower the risk that your child will be born with intellectual disabilities. In families with a history of genetic disorders, genetic testing may be recommended before conception. Certain tests such as ultrasound and amniocentesis can also be performed during pregnancy to look for problems associated with intellectual disability. How is intellectual disability diagnosed? Intellectual disability may be suspected for many different reasons. If a baby has physical abnormalities that suggest a genetic or metabolic disorder, a variety of tests may be done to confirm the diagnosis. These include blood tests, urine tests, imaging tests to look for structural problems in the brain, or electroencephalogram or EEG to look for evidence of seizures. In children with developmental delays, the doctor will perform tests to rule out other problems, including hearing problems and certain neurological disorders. If no other cause can be found for the delays, the child will be referred for formal testing. Three things factor into the diagnosis of intellectual disability: interviews with the parents, observation of the child, and testing of intelligence and adaptive behaviors. A child is considered intellectually disabled if they have deficit in both IQ and adaptive behaviors. If only one or the other is present, the child is not considered intellectually disabled. After a diagnosis of intellectual disability is made, a team of professionals will assess the child's particular strengths and weaknesses. This helps them determine how much and what kind of support the child will need to succeed at home, in school, and in the community. What services are available for people with intellectual disability? For babies and toddlers, early intervention programs are available. A team of professionals works with parents to write an Individualized Family Service Plan or IFSP. This document outlines the child's specific needs and what services will help the child thrive. Early intervention may include speech therapy, occupational therapy, physical therapy, family counseling, and special assistive devices, and nutrition services. School-age children with intellectual disabilities, including preschoolers, are eligible for special education for free through the public school system. This is mandated by the Individualized with Disabilities Education Act. Parents and educators work together to create an individualized education program, which outlines the child's needs and the services the child will receive at school. The point of special education is to make adaptations, accommodations, and modifications that allow a child with an intellectual disability to succeed in the classroom.